Armageddon.
Aaron Katersky reporting, and you're listening to ABC News.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, M.D., New York's only Harvard-trained, triple-board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WABC studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, good morning. It's Gil Lederman. I'm here with John Taransky. John, how are you?
Good morning. I'm good. How are you?
You look fantastic. We have Bruce at the controls. He's waiting to take your calls. So if you have questions or calls, we're live. We're not like the pre-recorded
Other shows you might hear.
fruit shows. So we're at 800-848-9222. So again, it's 800-848-9222. We're in the WABC studios, which are actually just a couple minutes away from our office.
Yeah, I don't think we could be any closer.
Yeah, so people say, why did we choose this place for our office? Well, because it's convenient. We're the only medical office for radiation oncology that's in the middle, in the heart of New York City. We're a couple minutes from Times Square, Herald Square, Penn Station, Grand Central Station, Port Authority, PATH trains. It's an unbelievable location.
Yeah, for sure.
Because a lot of patients need access. We don't want you to take 5 subways to get to us. You can drive in. There's commercial parking, and there's the buses and subways, which how I get to work because driving in New York is tough.
Yeah, I try to avoid that every time I can.
So we're really super, super convenient and easy to get to. Anyway, just to tell you about what we do, because sometimes people say, who are you and what are you doing? My name is Dr. Lederman. I'm a triple board certified internal medicine, medical oncology, radiation oncologist. We have our own cancer treatment center in Manhattan at 38th and Broadway, 38th and Broadway. Our address is 1384 Broadway, 1384 Broadway. And our specialty is cancer treatment. We treat cancers and brain tumors. We treat cancers of the body and prostate cancers. We have our own facilities, so you don't have to walk through 50,000 miles of corridors and strange faces. When Mr. Smith or Mrs. Jones come to our place, we know who you are, and you know us, and you know our staff, and there's a smiley face to take care of you and your needs in our facility. So it makes it a lot easier. And we're going to talk today about some of the complications of hospitals, like super infections. And we just had a friend die in a hospital of a super infection. And super infections are caused by the bugs you don't see, but the bugs that are there.
Yeah.
And a lot of hospitals have bugs percolating around. People get a lot of antibiotics, super antibiotics. They're in the ICU. And when you get more and more antibiotics, you get stronger and stronger bacteria. And when a person is frail, that bacteria can be fatal. And just last night, one of our patients who went to get blood transfusion, so doing it as an outpatient, decided it'd be easier to do it in the hospital, got IV line and died.
Wow.
Became septic and died.
Unfortunately, yeah.
So we just encourage people to stay out of the hospital, avoid unnecessary drugs and antibiotics, stay healthy, stay in a place where there's not super infections. You can walk in, get your treatment, walk out within minutes. So that's the key. Get the cancer treated, hit the cancer, and leave the body alone.
Yeah. I mean, Doc, I've been to your office many, many times, and it doesn't have that hospital feel, which is a good thing.
Or the hospital smell.
Yeah, that too. That
Right.
too.
So it's a big thing. When you come
Yeah.
in, you get excellent care. We were the first in America to do body radiosurgery. Our staff is devoted to hitting the cancer and avoiding harm to the healthy
Yeah.
tissues. So it's very different. We're going to talk about children who had standard radiation and chemo over the years, and now they're aging at a very rapid rate, causing them to be very frail.
Sure.
So there's many reasons to stay out of the hospital, totally stay out of the hospital. It's not a healthy place to be. We're taking your calls. Our number here again is 800-848-9222, 800-848-9222 at the WABC studios. I want to talk about quite a few cases. We have quite a few news articles this week, even though it was a holiday week. I know most of us froze. Some of us even had burst pipes. So if your furnace wasn't working or your pipes were broken, I hope you got everything back together again. I know a lot of people are suffering from pipes and furnaces and the cold. And
the polar vortex is what I kept reading.
Right. So hopefully today it's going to be warmer
Yeah.
and you're getting everything fixed up.
Good.
I want to talk about options, because I really believe that people who have cancer have options. And if you don't like what you're being told, you should get a fresh second opinion. It's really important. And I'm just going to talk about one woman who I know very well. I've known her for about a decade. She had colon cancer, and when she was diagnosed in 2008, it had actually already spread to lymph nodes.
Okay.
So she already had stage 4 colon cancer. And for the first couple of years, she got chemo, and she got incredibly sick, and she got into the hospital, and there were these multiple episodes where she just got worse and worse and worse, and she had all these complications from chemo. And I don't ever like to push anybody. I don't think people should be pushed. I think they should choose the option. They shouldn't be pushed into an option, because I think being pushed tells you something not very good.
Yeah, it has a negative connotation to it.
So
for
3
sure.
years ago, she was getting more and more chemo, and she ended up nearly dying. She was in the ICU, in the hospital, and I would see her every day to try to pull her through, to give her the motivation
Sure.
to pull through.
Right.
And honestly, I didn't think she'd make it. She has a lot of other medical issues, but thank God she did. She has a faithful, loyal son who helped her, and a few other people, a sister who helped her. And she pulled through it. And when she pulled through it, she decided that she would never, ever again take chemo.
Mm-hmm.
And she's changed her whole strategy of taking care of the cancer. So now if there's a nodule that pops up in the liver or the lymph node, in the past, her doctors would just give her chemo.
Yeah.
And she just tolerated it poorly. She never actually even finished a cycle of chemo, even though she had about 2.5 years of chemo. She just couldn't tolerate it. And eventually, every time that she got into trouble, she chose radiosurgery. And she actually saw that it was the radiosurgery that was putting her into remission.
Right.
So radiosurgery is not surgery. Radiosurgery is non-invasive treatment. There's no cutting, no bleeding, no hospital stay. There's no hospital.
Right.
Which is even better yet.
Sure.
No hospital. And we were able to hit the cancer. And over the next 3 years, which has been about the last 3 years, we've treated some lymph nodes. We've treated a cancer in the liver. This is all from the colon. And every spot we have hit has been in remission.
Good. Wow.
Every spot.
Yeah.
So we're about 10 for 10. And that's about our average. I mean, we're not perfect. Overall, we tell people it's about 90% rate of success for the rest of the life of the patient where we aim the beam. So she just got a new CAT scan, and this is now going into the 6th year of her cancer. And there's a few small nodules in the lung. I told her all the options, and the options I included chemotherapy, I included doing nothing, I included radiosurgery, I included surgery. And you have to remember her background. She is a woman who had a lot of surgery and a lot of chemo and had the complications of both, and just didn't want any part of it. So I told her, well, the cancer's in the bloodstream. And medical oncologists, chemo doctors always say, well, it's a systemic disease, so you need systemic treatment. Well, maybe, but maybe not. Just because it's systemic disease doesn't mean you need systemic treatment. Just because there's a nodule in the lung doesn't mean you need chemo in your vein going from head to toe.
Yeah.
You know, the chemo often causes a lot of neuropathy, which is numbness in the fingers and toes, sometimes hearing loss. Often it damages the bone marrow.
Sure.
And she's thinking back, every time she had chemo, she had complications, and every time she had radiosurgery, she had success.
And it turns out the success with radiosurgery has kept her cancer in remission.
Right, she's been in remission. So, but on the other hand, I have a friendly relationship with her, and I wouldn't push anybody to anything. And I told her, she said she wants radiosurgery. She loves radiosurgery, that's what she wants. I said, look, you go home, talk to your son, don't make any sudden decisions, and we'll talk. So she went home, she spoke to her son. Next day the son called and asked what I thought, and I asked what he thought. And again, I spoke to the patient, because we don't like to hurry people. We think they they deserve their time. And she chose to proceed with fractionated stereotactic radiosurgery for this lung nodule. How do we do that? Well, we make a frame. It's a stereotactic frame. It's custom made for the patient. It's totally painless. There's no cutting, no bleeding, no pins, no screws, no surgery to put gold markers in. This is the original radiosurgery that we brought to this country, and we've treated about 20,000 patients, so we have a lot of experience over many years. And that's how we've treated her, and that's how she's had 10 for 10.
And that's exactly what you want, and what she wants.
She wants 11 for 11.
Of course. Good.
So we're going ahead with radiosurgery for this woman, and we wish her well. She's done great so far, and we wish that she continues to do well. And for those of you who have a cancer, or God forbid, you may want to investigate other options. Just because you have a nodule doesn't mean you need endless chemo. You may want to think about other options that give your body a rest, that don't cause harm to the whole body, that go where the action is, which is where the cancer is, and do it in a non-invasive, outpatient, non-hospital setting. We're not likely to get super infection and complications leading to you-know-what.
Yeah.
So we're going to stop at that point. We have a word from our sponsor, the man with the better than golden voice of mine.
Yeah.
And then we'll be back to take your calls, take your questions, and talk more about articles, news articles, and how to live better, how to be healthier, how to avoid cancer, or if, God forbid, you have a cancer, how hopefully we can get rid of it or control it.
And while we go to break, give us a call when we arrive back, because we are live, 800-848-9222. Again, 800-848-WABC, and that's 9222.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery New York. For prostate cancer treatment, results and quality of life matter. Hi, I'm Dr. Gil Lederman from Radiosurgery New York. Our enviable record includes treating thousands with prostate cancer. Critical to every man with prostate cancer and their loved ones is quality of life, urinary and sexual, and great treatment data while avoiding surgery. Treatment here is outpatient, with most insurances, Medicare, Medicaid accepted. First in America with radiosurgery for cancers from head to toe, we have the expertise to hit the cancer. Our fresh second opinion could change your life. For prostate cancer treatment, call 212-CHOICES. 212-CHOICES. Radiosurgery New York. Super conveniently located in Manhattan at 38th and Broadway hits the prostate cancer. Call 212